So when patients ask, and it's more common that significant others ask, how long does the patient procedure take when we're doing the FUT? We like to tell them it takes all day. And the reason I say that is because of the fact that we're perfectionists and no one goes home until it's absolutely perfect. Obviously, it's going to depend on the number of grafts that we do. The more grafts that we do, it's going to take a little bit longer. But one of the nice things with the FUT, no matter how many grafts we're doing, it's done all in one day, and you can overlap the steps of the procedure. I can take the strip of tissue and then I can hand that off to my staff who's going to cut it under the microscope into the individual flicker units, and then I can make the incisions and we can actually start placing while we're still cutting the grafts and kind of work in conjunction to complete the procedure in a shorter period of time. But we never rush, and if you ask any of my staff members how long it takes to do the procedure, they'll generally tell you about a half day, and that's because 7 to 7 is less than 12 hours.